So at this time, I'm happy to introduce to you Perkins Director of Community Programs, Teri Turgeon, and Infant Toddler Coordinator, Brenda Allair, presenting on Infant Toddler Telehealth. Both Teri and Brenda have deep, meaningful connections to this conference as parents themselves and planners. They've been where you are today, and they understand how informed decisions early on will shape your family's journey. I'm so honored to work closely with these two ladies and impactful professionals. Take it away, Teri and Brenda.
Amy, thank you for that wonderful introduction. Let me just pull up my presentation, our presentation. Just give us a second. I'll start it from the beginning. Perfect. Excellent. Well, Amy, thank you for that wonderful introduction. Brenda and I are really incredibly happy to be here and to share more about the telehealth model and Perkins' response to the pandemic. As former infant toddler parents ourselves, we feel like we're sort of coming full circle, and we're so incredibly happy when we see those poll results that 50% of those in attendance are families of birth to 3. And so that's incredible. Obviously, as I said, today's presentation is on the evolution of telehealth and Perkins' response. But to provide some background to our listeners, it's important that you know that the Infant Toddler Program just celebrated 40 years providing services to children in Massachusetts who have a visual impairment, or as Dr. Lawrence just said, may have a suspicion of a visual impairment. In fact, we're one of the few states that a child can be referred for infant toddler services based on suspicion. Over the years, our program has certainly grown. In those early days, 10 families in the Boston-based area, to now 500 children and families come across Perkins' doorstep annually each year. In addition to our traditional home visiting model, we also have 3 on-campus parent groups. We have an incredible teaching staff of 17. In fact, everything we share today is really their work, so we want to honor them, along with a lead teacher and a coordinator. The provision of high-quality vision services has always been the highest priority of Perkins School for the Blind and certainly our teaching staff. But COVID-19 caused major changes to our professional lives and our operational norms. But we were really well situated, quite frankly, to make necessary adjustments very quickly to our program design, moving from a pilot that we had first started back in late June of 2019 and July of 2019, and really moving to a full operation of a telehealth model. We based much of our early work on the Clark School for the Deaf, and we had encouragement from the Department of Public Health, the lead agency of early intervention here in Massachusetts. And that pilot began in late June, early July of 2019. Brenda, do you want to share more about what we thought those early days of the pilot were going to look like?
Absolutely. Teri, thank you so much for sharing about our program. As Teri said, back in the summer of 2019, we were really thinking about telehealth as kind of a long-term prospect for our program. We had gathered a group of 5 teachers, and we really wanted to start thinking about how we might implement telepractice visits, within our program as it exists. So we did a research review, and we really looked at how similar services had worked in, as Teri said, the deaf and hard of hearing community. And there was some really great information there, but there was no existing studies on using telepractice for families of children with visual impairments. And so really at the time, what we were thinking, and again, this was far before anybody had heard about COVID, was that telepractice would potentially be a way for us to continue providing these really rich services when in-home visits weren't a possibility for some families. So our thoughts were really around geographical challenges. Perkins Infant Toddler Program serves all families in Massachusetts, which includes the far sort of rural areas of Western Massachusetts, but also the Cape and the islands, Martha's Vineyard and Nantucket, and we have had families on those islands. And sometimes that's challenging in terms of physically getting to those places. We also know that some families are really overwhelmed with the number of providers that they have. We have some information about the families that we serve, and a good number of them really have 6 or more early intervention providers that they work with, and that's a substantial number of in-home visits. And we also know, as you've heard earlier today, many of the families we work with, their children have some complex medical issues. And so those children often have many medical appointments, and families are juggling that as well. And so we really wanted to think about could we use telepractice maybe to support those family needs? We also considered, to make sure we had consistency for families, if we had potential maternity leaves for teachers or other absences. So we started with 10 families, sort of ironic, Teri, that 10 families started the initial Infant Toddler Program. So we had 10 families who volunteered really to be part of the pilot. And of course, we were thinking we were going to do a hybrid model. And at the time, brand new word, hybrid, in person and telepractice together. Now we know hybrid is very, very frequently used. So we set up some data collection at the time too, and Teri's going to talk a little bit more about that later. But really, we wanted to make sure that we were capturing what we were doing and making sure that it was effective. But in those early days, really what we were focusing on is creating and developing a set of best practices for telehealth. We use the PEWE model, which is parents interacting with infants, and it's really aligned with the Massachusetts early intervention approach. And it focuses on parent coaching as a model of intervention. So we wanted to be sure that as we were thinking about telepractice, we weren't just trying to take what we did in the homes and somehow translate that into a virtual format. We really wanted to think about building parent skills and providing some important information to families using this new model. And so, what did a telepractice visit look like for us in those early days? And we've got a couple of really great examples. So we're going to take a look at a couple of clips. And this first clip you'll see, this is an example, a really great example of parent coaching by one of our teachers, Stephanie. And you'll notice in the video how she provides some really wonderful information to this child's mother. And also dad, you'll hear him in the background, about how to position the book that they're using. And she also models a really great visual skill. And you'll see that in this video.
When you hold it, how she's having to lean like really far forward, if you can try to tilt it up a little bit higher, she might not have to lean forward as much. Okay, I could be wrong, but yeah, we don't want her to like be hunched to get into the habit of always hunching.
Don't know.
Okay, thank you anyway. Julia, can you point to the fox? Yeah. You see my hat? No, I have not seen any hats around here. Okay, thank you anyway. The froggy.
Isn't that such a great video? I really love how Stephanie, just in that very short clip, does such a wonderful job of kind of all of the components of early intervention, really thinking through what is important for this child's visual skills, and also such a wonderful job of modeling and of course observing, what is that child doing and what are the parents working on. This next video is a video with Jessica, who again was one of the teachers who was working in our pilot program. And Jessica's going to demonstrate a few other important ways that telepractice has been effective. I'm really modeling for the child and the mom about following the child's lead in play. And of course, you'll see supporting some emerging communication skills.
Hey, Em, are you playing? Hi. What are you playing with? You have a notebook and paper. I see. Yeah. Hi. Oh, you're good at shaking that, huh? What are the toys you have? You want to play some more toys? Where are your toys?
Show us some toys in it.
Ooh.
What do you want to play with?
Toys or paper? You like Violet? Violet? Is that Violet? Does she sing to you? She does? Can you make her sing? Yeah.
Such a great smile, and those glasses, just charming.
I know.
Such a great, great example, but I'm also struck, Teri, about how much we've improved our technology skills since the beginning of that pilot. We can record a little bit better now, and it's been great. But that was the summer of 2019 and into the winter of 2020. And we were really sort of gearing up our pilot, and we were collecting some teacher feedback about how things were going. Most importantly, we were connecting with parents and finding out how they were feeling about the project. And we were updating our practices and our strategies in telepractice and thinking about what are we learning? And again, identifying this as a long-term goal for our program on how to integrate this. And then, of course, Teri, March of 2020 arrived, and our pilot program, this small 10 families, suddenly need to grow a whole lot larger. So Teri, can you tell us a little bit about what it took to pivot from this really tiny pilot into the whole program of telepractice?
Absolutely. I don't think I'll ever forget that time. Do you remember, Brenda?
I do.
We were practicing for 2 weeks, teaching each other, but it really first started with obviously the closing of schools, the closing of Massachusetts schools. Perkins closed for a short time, for 2 weeks. We put a stop to services for 2 weeks. Even our itinerant-based services stopped. And we really capitalized, I think, on that time together. To really, teachers changed from teaching the families and children on their caseloads to teaching one another. And, as scary as a time that was, when I sort of reflect back on it, I also think that it was probably one of the richest times in our program, because we oftentimes look outside ourselves for expertise, and we really have such incredible expertise just right with us.
Such a collaborative effort.
Absolutely, definitely. And teachers really started with the basics, whether it was learning how, going from a paper calendar they might have done as an itinerant teacher, home visiting, going in with their bag of toys, working with families directly, to using a Google Calendar, how to set up an invite, how to use Zoom, or even Google Hangouts or WhatsApp app. We were really pleased because we contacted the Department of Public Health. You may remember in those early days. And they were actually really happy because we were the first specialty provider in Massachusetts to actually reach out to them and say, well, we've been doing this pilot. Would it be okay with you if we scaled what we're doing to really make sure that every family that's connected with Perkins remains connected despite the pandemic? How do we do this in a way that's effective, but also keeps everybody safe? And so we identified those teachers who could teach their colleagues. And we also worked to identify teachers who might need additional supports, because that was important as well. We also offered to any family for whom didn't have technology the opportunity to obtain technology from Perkins so that they too could successfully participate. And we were able to do so much of this work because of philanthropic support that we had received from donors, above and beyond, obviously our work with the Department of Public Health. Those first 2 weeks were really such incredible, intensive professional development with one another, and really changing in many ways our parent coaching model. In the past, as teachers, we would have gone in with our toy bag and we would have worked with the child and the family, but we were really sort of sharpening our pencils around what does a parent coaching model look like? And using the family guided routines-based interventions, we sort of intentionally changed our practice. And so on the slide, you can see this parent coaching model. It has 4 elements, sometimes referred to as SOPR, the acronym for the field. But just for our listeners, S stands for setting the stage. Working with the family to get updates. What are their priorities? What do they want to work on? It's less about what I want to work on as a teacher or what you want to work on, right? But what they want to work on. So what are their priorities and what are the routines within their day? And so we develop a plan from then, and then all good teachers spend time observing. So observing the interactions between the parent and the child, and then making coaching strategies. So it's less about me going in and doing home visiting to see the child, but rather it's home visiting to see the parent, but now doing it virtually. And using those coaching strategies to help the family understand what strategies might work, and problem solving, what worked, what didn't work. And I think this is my most favorite part. It says expand opportunities and context into practice, because we know from our own evidence-based research that practice leads to mastery. And so if we can teach parents how to do our work in our absence, the outcomes for that child are greater. That is probably for me one of the biggest takeaways when I think about this coaching framework. And then reflecting with parents around what worked for them, what didn't. And as you think about, are there areas of your day you could practice some of these strategies? Then the next time you meet with a family, you're actually starting back at setting the stage again. You're gathering information. How did things work? And you're sort of always constantly retooling this. Let me show you as well. Sometimes it's difficult to sort of say, well, what is, showed you a couple of videos, but we wanted to also, this is an early day lesson. Yes, one of our first, and there's an incredible video that accompanies this. But this is our teacher the visually impaired, Stephanie, and she modified a book from the American Printing House called That's Not My Bear to That's Not My Elmo. And she's working with her student Schroeder and his mom, Elvin. And she had pre-worked with the mom to make sure that they had materials on hand, to really coach the mom on, we were going to work with Schroeder. Schroeder's job in this lesson is actually to touch the switch, and it's been pre-programmed for him to say, turn the page. And so when you're not going to see the video today, so I'm just sort of setting up and telling a story for you, but they had wait time. At points, Stephanie had to actually coach mom maybe to provide some support under the elbow, to move the switch a little closer. And I loved it at one point where she actually directed him about where to put the materials in terms of his best viewing. For me, I think it's an incredible representation, although an early one, of what a telehealth model can look like. You said something when we were getting ready for this. You said, if we had been back in person when this is if this lesson was taking place, she would have read the story, but she would have been doing all the things that mom was doing in the situation. But instead, mom is doing it. And we love that because we know that mom is going to grow in her own confidence to carry out these interventions, even when Stephanie's not there.
I think that's one of the really big lessons that we've learned is as teachers, we've learned to step back, and Stephanie had, in this video, she did a great job. And you can sort of see just in these photos, clearly Schroeder had a great time with this lesson. And these are things that the family can carry out into other routines throughout Schroeder's day.
Absolutely. One of the things that's at really the heart of our program, and we'll talk more about those things, but really meeting families where they're at. And again, it's working on what's important for them at the time. And we're still doing this today. Our program continues to be virtual. And we work with families to make sure APH materials are shipped to their home, that our services and our instruction after that are around how to use those appropriately. We're doing porch drop-offs. So materials from our Adaptive Device Center continually have been made for our families in Massachusetts. Teachers are picking those up and dropping them off and sharing them with families. So while being a challenging year, it's still been a really exciting one of growth.
It's been great. I think it's so interesting, Teri. I remember when we were initially in the pandemic and teachers were not driving, as itinerants, we spend a lot of time in our cars. And so we weren't driving. And I think families were excited to have some porch drop-offs, and teachers were excited to get back in their cars after a little while. Absolutely. But, we knew that pilot and then this early work, we really figured out that replicating in-home virtually was not effective. That wasn't really the focus of what we were trying to do. What we really wanted to do, as you said, Teri, was to keep the fundamentals of the program, the core beliefs and the heart of the program, but to just deliver it in a new way. We wanted to identify what were the most important elements of our infant toddler program, what were the most important parts of our work as teachers, and to make sure that we kept those as we moved into some virtual formatting. And certainly as we scaled up from this very small pilot to, the hundreds of families that we see. So as Teri said, we've been doing this work in the infant toddler program for 40 years. Sometimes it feels, Teri, like you and I have been doing this for 40 years, but, and we know that early intervention, the parent connection, is really one of the most important parts of what we do. I might say the most important part. And we realized probably around the end of summer, August of 2020, that it might be a while before we could bring children and families back onto our campus. And it was really important to us to continue providing opportunities for parents to connect with each other. As former parents ourselves who attended the infant toddler program and really benefited from that parent support, we knew how valuable it could be. So, we thought a lot about how can we make the structure in a virtual world really reflect what parents still needed. And we were lucky that we were already working with a music therapist.
Yeah.
And so she helped us think about, how to incorporate children into this virtual group. And so, I've been lucky enough to participate in a couple of these parent groups, and just phenomenal. So you'll see, we've had children at home with some homemade musical instruments, and the music therapist doing some really fun activities. And then they transition into some time for parents to chat, what are the challenges they're having? And one of the things I think is most important, Teri, to have a place to share their joys. I think that, we've heard a little bit about that today, about parents do hard things, but they also want somewhere to celebrate their children.
That's right.
And group can offer that for them.
Brenda, do you mind if I just interject?
Of course.
It's interesting because now we're a year into this, right? And a lot of our families have transitioned out who we were once in person with, right? In fact, we heard from our social worker the other day, a mom who's new to our group. She values so much this opportunity to connect, and she's from far Western Mass, right? So she wouldn't have normally had the chance to have driven in and taken part in groups. So it's really good.
I think it's been one of the great opportunities we found, is the ability to have parents who might not otherwise have been able to get onto campus to participate and really reap the benefits of that. One of the big concerns that families had, and frankly we had as well, was concern about children who were turning 3 during this part of the pandemic. Typically, when children turn 3 years old, they transition out of our program and they go on to whatever is next for them, which for many of our children is a preschool program. And so at the time, as Teri mentioned, schools were shut down. We didn't know when or how they might reopen, and they were not able to do the assessments that typically accompany that transition process. And so we were committed to making sure that none of the children in our program went without services during that period of time, knowing how crucial it was for families. As Teri said, we had the benefit of philanthropic support, as well as the support of the Department of Public Health. And so we were able to continue supporting 195 families of 3-year-olds through this period of time. And I think many of them have come back and said really how critical it was for them as they struggled with the process that can be emotional even in the best of times. And certainly, during this was especially difficult. A little challenging for our teachers as well. If you remember, Teri, there was quite a few changes happening in the Department of Education and preschool-based services. And so our teachers were sort of meeting every week to keep up to date on that.
Do you remember though, every week it sort of changed? I go back and read some of my notebooks from that time. And at one point, do you remember the Department of Elementary and Secondary had thought that schools would absorb those kids who had already turned 3. And then I think at some point, they started thinking about, well, which agency really knows these children and families best? And wouldn't it make more sense if they stayed with Part C, early intervention and transition in October when all schools reopened? And so we were really lucky, but it did change what we were doing, like week to week, because all of a sudden we had some kiddos who turned 3 in March who were now 3+ and normally would not have been a part of our program.
We were doing some really nice preschool lessons for a little while. I will say that our teachers really met all of these challenges
super flexible,
incredible commitment, creativity, flexibility for families. And I think one of the examples, Teri, that really exemplifies that challenge and that creativity was virtual assessments. So, as part of the pilot, we were doing hybrid, as I mentioned before. And so assessments were being done in person, as we have always done. But that wasn't possible at this time for safety reasons. And so we really had to think about, we know how important assessments are to identifying a child's skills as children turn 3, to identifying what they might need in preschool. And so we got together as a group and with some outside support as well to talk about what we would do for assessments. And what we discovered really was that all of that parent coaching and that parent partnership was the key to doing a really good virtual assessment. And so we're going to show a clip about just a very brief moment in an assessment that one of our teachers, Burju, had done. And then I'm going to share a little bit about how we accomplished this.
Yeah. And I think, it's one of my greatest prides is to watch teachers' sense of confidence and competency really build over the course of this year around this particular topic. Although not always optimal or what we would elect to always choose to do, we couldn't let kids not successfully transition into the next setting. So Oh, excuse me, let me go back. Give me 1 second.
Should we build a tower? Should we build a tower with people and then we're gonna let down? What do you think? 1, 2,
I love the turn taking.
3. Another one on top. Some more. 4. 5. One more. Just give it 6.
I just love his big smile. He's clearly very proud of himself. You might notice that unlike some of the other videos, this has sort of 2 images
Views.
of
Yep.
this child. And one of the things that we talked about and one of the things we discovered was that when it's possible, having 2 views of the child enabled us as TBIs to really get a better sense of how they were using visual skills. It's not always easy, as many of you know
Yeah.
from being on Zoom, to identify certain things. And one of the things that Burju did, as all of our teachers are doing, is to really support parents through the assessment. And so we provided a lot of information to parents about what exactly we were looking for, helped them gather materials from their own home, toys, sometimes regular household materials, to help us with the assessment, and really guided them through the process. And one of the benefits, Teri, I think that's been fantastic really as teachers, is that we've been able to explain assessments in a way that parents can understand, and that they can take that information then and be better able to describe their child's visual needs, and understand how their child's visual impairment might be impacting different areas of development. I think that, teachers really benefited from having to think through assessments, but families have also benefited from this. It's not to say we would continue always doing virtual assessments, but it's been important to make sure that children have this aspect of our services throughout this time. And you'll see, we've done a lot through this time of pandemic, and this is, again, the work that we've been doing. We wanted to capture all of that work, all of, as Teri said, this incredible work that our teachers were doing. So we kept detailed notes on all of our sessions. We continued to collect some really important data. And so we grew, from these 10 families, now all of a sudden had data from hundreds of families. And it gave us a lot of insight into what was effective for families and how we could best, as a program, meet the needs of families. Teri, I'd love to hear a little bit more about what we learned, and if you can share sort of all the data that we collected.
Sure. Well, it's important too to tell the audience, Brenda, we talk a lot about that 2 weeks of intensive professional development, but as the year unfolded, and still today, we still continue with weekly professional development. I'm thinking back to the assessment brainstorming bunch, where we had teachers who said, I'm going to put a meeting on our calendar. Those who can come in, please share your resources. And it was there that we really were able to sort of wrap our head around assessment. We brought in experts like Ellen Maisel around CBI or Dr. Cran. But we also, started to think about, like you said, all of those materials that are in the home and how can we do this in an effective way? And what specific language should we write in our reports that helps assist the district once schools reopen and that child actually is in their setting. And so that professional development, I think, has continued even through to today. But yeah, let's talk about some of the data that we've collected. We were really lucky as an organization to partner with a third party, the Donahue Institute, which is a department within the University of Massachusetts system. And it was nice because they were a neutral third party that knew what our intent was around that initial design as a pilot. They watched us scale this model and was serving hundreds of families, not just those initial 10 families, which we're indebted to. And so let me just show you a little bit about the numbers. So that first number on the bottom, January to March 13th, 2020, those are the 10 families. We've done 44 virtual visits. Those are hybrid though, because those families are still getting an at-home visit. And then the start of the pandemic right there, March 26th to June 2020, we've done 1,133 visits. That data alone, we've done 25 times more visits in the first 3 months of the pandemic than the 3 months preceding the pandemic. So it really just, teachers embrace this. They care deeply about wanting to ensure that families stay connected to Perkins. And then you can see from July to October, 2,447 visits. And it's those 195 kiddos who would have already transitioned that are in that October
Captured
number.
right in there.
Absolutely. And then this is a year look, right? So from the beginning of the pandemic in March of 2020 to March of 2021, we've done 5,210 telehealth visits, not in-person visits.
Such an amazing number.
It's an amazing number. And I just looked at it the other day as we were preparing for this, and it was like 5,700, every time it's just more and more. And we've also, actually, it's important for listeners to understand that not all families, I mean, how many of you remember when the pandemic first hit, thought this was going to be a 2-week problem?
Yes.
All right. And then summer.
Maybe a month.
Okay. And then summer, and you're like, this will be solved by September, right? We'll be back at it. And so we had some reluctant families initially who said, I don't think this is going to last very long. I'll wait for in person. And as time unfolded, it quickly became clear, I think, to everyone that it wasn't safe to home visit right now. And so more and more of those families have come back and are back in the program.
Right, Teri, and I'm happy to say we've had families really who've heard that the telepractice is going very well.
Yep.
And so have reached back out and said, I wasn't sure that I wanted this
Yeah.
service. I know it's been a few months. Can
Yeah.
I come back? And
Yeah.
of course,
They
we're
can.
happy to have
Absolutely.
them connect with us and have done really well and really found the benefits of telepractice.
And our teachers, I think, make it a general practice. If there's been a family that either, was reluctant, to just make sure that we circle back with them. Some of what we learned, though, as we engaged with caregivers, is that their sense of confidence really increased. I look at this and I'm so incredibly happy by this number that, parents felt as though that increased their own set of strategies that they would use. They felt more confident in those strategies, and that their own sense of engagement had increased. One of the things that I find remarkable as I think about this, Brenda, is that the whole world was thrown into this pandemic. And we were just really fortunate to have started a pilot and begun collecting data so that, because we know anecdotally, I think we always have stories, but to actually have real data that we can share with the field and with other providers. And in fact, we've had other states call us to ask what is Perkins' response to the pandemic has been. And we've been able to share with them what we're doing, which is really incredible. Routine-based interventions are easier when using a telehealth model because a teacher could come in on a variety of different times during the day. Parents, really reporting this increased level of engagement, their self-confidence. We sort of always knew as practitioners that this is what we're happy to see that the data plays out in the way that we certainly have experienced it. And lastly, one of the things that we find really remarkable is, and I think is one of the silver linings, quite honestly, is the number of people who are able to be present during a T-visit. We see an increased level of engagement from fathers because I think very traditionally it's oftentimes mother and children. Another early intervention provider being able to participate.
So many of those.
Yes, absolutely, because they were virtual as well, right? And so none of them were driving and their calendars suddenly became easier to manage. The ability to come together and actually attend IEP meetings or an IFSP meeting and to be able to do it virtually. We're really excited, actually, not related to early intervention, but as kids transition, we learned last week that Department of Elementary and Secondary Ed in Massachusetts has said that IEPs next year can be virtual.
Which will be
It
wonderful.
will be great. It'll be really great. As I think about this, one of the things that's been incredible about this, not just this more transdisciplinary approach to interventions and this opportunity to collaborate with our colleagues, but we've also been able to maximize our deafblind specialist. We have one in our Birth to 3 program. And so she's been able to share her expertise with families regardless of where they live. We have always had what we call a Let's Move consultation. That's an early orientation of mobility, kind of look and see, not necessarily an assessment per se, because we really want them to be assessed in their preschool setting when they transition, but it's provided us more opportunities for orientation mobility instructors to come in virtually and provide some consultation. That's not something that's part of the EI system currently right now. Perkins just provides that because we know it's best practice, but that's been terrific to have as well.
I think what strikes me about all of this, Teri, is these are all things in March of 2020 that we thought, well, that's something.
Wouldn't that
we
be
won't
nice to
able
do?
But that's probably too challenging.
Yeah, yeah.
We'll have to wait
It would be
until we're
nice to
back
do
in
it.
person.
Yeah.
And we've really, as we both said, the teachers have just such a determination to make sure that children are getting appropriate services, and really the robustness of our program even though we aren't able to be there in person at this particular time. And I think that's really
Yeah.
just a testament to the kinds of teachers that we work with, and really our program's long commitment to children and families.
Absolutely. So as we look to the future, Brenda, we're hoping that we might be able to do some type of return to in-person for our Birth to 3 program. Our teachers have been vaccinated, which is incredible news. And I know we've all been incredibly grateful to Perkins for
Yes.
that. It was in a very emotional time, I think, for all of us. But we'd like to think about a resumption of in-person services, starting first outside, weather permitting, which I know sort of seems like, well, why not just come right back into homes? But it's difficult to control every environment that we go into, and it's important that we keep everyone safe. But we think that, when we think about providing services in the natural environment, that includes their backyard, their playgrounds, their libraries, it doesn't necessarily have to be in their living room per se. So we're really excited about this. Our teachers have been provided with PPE. And as we move forward into the future, I think one of the most unfortunate things we could do of coming through this pandemic is to say, okay, we're back, and not learn from all the things that we've experienced this past year. And so we really hope to offer a hybrid approach of both in-person and telehealth, as we think about a return to in-person
Absolutely.
outside,
And I
at
can
least
tell
at
you,
first.
Teri, as a teacher who's also
Yeah,
out in the field
yeah.
and seeing children, I'm thrilled to be able to think about seeing them in
Yeah.
some of their outdoor space. Thrilled to kind of start playing a few distanced activities.
Yeah,
But more importantly, I think, is coming back to this program knowing that the telepractice works.
absolutely.
And so we
Parent
don't
coaching.
feel that we've lost anything.
I think we're
working
actually
with
better.
families. I agree. I think
Yeah.
the parent coaching has been a tremendous boost,
Yeah.
for families and teachers. And I think that's one of the fantastic things we learned throughout this process.
Absolutely, absolutely. So that concludes our presentation.